Seiko makanisi andindega dindangariro zeruno wamaindiva.
At community halls in Harare, audiences gather to watch Chiedza's song, a true story of a young Zimbabwean woman who has grown up with HIV. The audience sees the world through her eyes. They hear her thoughts, hopes and fears as she struggles to survive through childhood and teenage illnesses she does not understand. Chiedza only finds out she is HIV positive when it is almost too late. She is 16 years old and her family have given her up for dead. The film is designed to give a voice to young people living with HIV, to open up the problems they face with families, communities and healthcare providers.
Ndini Chiedza. Ndinoda kuti mese muzive kuti ndiri kurarama ne-HIV.
Showings are followed by a community discussion, which never fails to be lively. The project is a good example of the kind of initiative recommended by a Lancet Commission, which has pulled together global research into adolescent health and well-being. The world today has the largest ever youth generation, 1.8 billion people aged between 10 and 24, almost a quarter of the human race. As the Lancet report says, adolescence is a time of great opportunity, but also great risk. Major advances in childhood health and the opportunities of a digital age offer the prospect of these being the healthiest adolescent generation ever. But threats from harmful drugs and unhealthy diets to unemployment, war and migration could undermine this potential. The Lancet research shows adolescents have had fewer health gains than any other group. The issues affecting them have, it says, been pervasively neglected.
Hello, Chiedza, good morning.
In the film, Chiedza survives to get the HIV treatment she needs. She is one of 2 million young people in the world living with HIV.
Down, up, down.
Their futures highlight well the balance of opportunity and risk outlined by the Lancet Commission. There is a great potential. A generation who, if given access to HIV treatment, could become a leading force in the fight against a deadly epidemic. But most HIV-positive young people do not even know they are infected. They are held back from accessing treatment by the fear in their families, the stigma in their communities, and the poverty of the health services. And without treatment, their chances of survival are bleak. Governments, the Lancet concludes, need to do much more to guarantee universal and comprehensive health care for all adolescents, including mental and reproductive health. These will require action not just from health ministers, but to build better education, economic opportunities, and laws for young people. Countries, the Lancet recommends, need to set up national youth commissions to focus efforts. International agencies need to invest in research.
Let's discover that you are HIV positive.
It's no longer a disease as such.
Above all, young people should be involved throughout, empowering them to build their own futures. Chiedza herself does this. She defies childhood poverty to get to university and study biochemistry. She becomes a peer counselor and youth leader. Her story an example for other young people struggling with HIV. But it still hangs in the balance whether Chiedza's success will be shared by the rest of her generation, or whether so many opportunities will be lost.
Baby,